Well, new at 10, 107 rural hospitals across America have closed in the last 9 years. Recent national reports suggest many more are on the brink. TV6's Sarah Jones is here now, and Sarah, Illinois is faring a lot better than some of these other areas.
That's true, Sharon. There are about 238 rural healthcare facilities in the state of Illinois. And the most recent closure was in 2016, but there haven't been any more since then. The Illinois Critical Access Hospital Network says rural hospitals have had to get creative in order to balance their budget.
There's a shortage of healthcare providers across the country.
We have been without a physician position being filled for almost a year now, and have only had 3 candidates.
And patients can feel it, especially in rural areas.
The biggest challenge with that is we see our patients leaving our community and getting care elsewhere, because our wait time for our 2.5 physicians that we have on staff can be up to 8 weeks.
The shortage of rural healthcare providers is about 4 times that in metropolitan areas.
Our rural areas all are known as health professional shortage areas, which is a designation which allows us to get access to grants to give loan forgiveness and that sort of thing for physicians coming out of school.
And to help with manpower, rural facilities have had to get creative.
Probably about 5 years ago has moved to a mix of 50-50 physician advanced practitioner mix in our practice, and that's helped a lot.
There's one hospital, 3 hospitals actually in southern Illinois, in a community, in a county that share surgeons, 3 surgeons, and they rotate that. So you have to be creative. Every day is a challenge.
Finances is a struggle for most rural hospital facilities.
You just don't have the expertise and the resources in a small standalone facility that you can in a large health system. And it's so beneficial, especially from a billing and contracting standpoint with managed care.
After 2 years of significant losses, the hospital in Aledo, which was once a standalone county hospital, decided to partner with Genesis. And it's a trend Ted says many rural hospitals are following. He says the partnership has helped with negotiating contracts with healthcare providers.
The funding hasn't changed, but what we've gotten more sophisticated on is collecting the money that's owed to us from the payers. Prior to Genesis, there just wasn't that expertise level, and so it was difficult to get payments from Medicare, from Medicaid, from commercial payers in a timely basis. It's a negotiation between that managed care company and the local entity. If you're part of a larger organization, you're going to have a little bit more power at the bargaining table than you would if you're just a standalone, where that managed care company may say, hey, here's what we're going to pay you. You either accept it or we're not sending any patients.
Medicaid expansion has also played a role in helping keep rural hospitals in Iowa and Illinois afloat.
Before Medicaid expansion, there was no payment for those patient services.
Some Illinois hospitals have tried to adapt the services they provide to help cover financial needs.
Trying to diversify and look at outpatient geriatric care.
But it's created gaps.
Over the course of time, we worked on developing new payment programs for small rural hospitals because they primarily served Medicare population and Medicaid. And many of our hospitals discontinued maternity services. When I started working with rural hospitals in 1999, out of 50-some hospitals, there were 25 that provided OB services. Now there's 6.
Rural healthcare facilities in Illinois have an ever-changing game of maintaining balance.
It's not just about paying bills in rural healthcare. It's too expensive or not expensive. It's about how do we keep that infrastructure in place.
In Aledo and Princeton, Illinois, Sarah Jones, TV6 News.
The Illinois Critical Access Hospital Network says it doesn't know of any hospitals facing immediate closures, but that Illinois rural healthcare facilities must remain vigilant.